This is the Emergency Medical Minute, sponsored by Mile High Ambulance.
As most of you guys know, me and my household have been gestating with a vengeance for the last year and a half. And so we're headed into our second flu season where we're going to need some kind of cold remedies. And so I figured cold remedies in pregnancy was probably a timely thing to go over again, because a lot of what we think of as using in colds are not options for pregnant patients. And so we'll kind of go over what we can use. We'll go over some of the homeopathic stuff that we should be using in all of our patients. And then ultimately we'll kind of go over some of the stuff you have to avoid in pregnancy. So the first thing is for fevers, and we'll kind of do this by symptoms. So the first thing is for fevers. Tylenol is really the mainstay of antipyretics in pregnant patients. We really recommend that as our first line. Up until 20 weeks, you can technically still use NSAIDs. After that, it starts to cause problems with the amount of amniotic fluid that's being produced. It can lead to growth restriction. And then ultimately, if you use it too far along, you can end up prematurely closing the ductus arteriosus and causing heart and lung problems in the fetus. So really we're avoiding NSAIDs for the most part. Tylenol is really your main go-to. For cough, over-the-counter things like cough drops really is the first thing you should be encouraging patients to use. We like them to have a humidifier in the room that they're sleeping in because that can really help relieve some congestion. You can use two of the main medicines that we use over the counter, Guafenesine and dextromethorphan. Both have some good evidence that they're probably fine in pregnancy. So those are both options with caution. We had, just as a quick aside, we had a patient that came into Belmar about a year ago that had really bad post-tussive emesis. And she had seen her OB and had been put on all of the antiemetics, but it wasn't really a nausea problem. It was that she had COVID, had this persistent cough, and then just kept throwing up after she was having these coughing fits. It had gotten so bad that she wasn't really able to tolerate PO anymore, and she was starting to drop her weight, which is a big deal in pregnancy. Yeah. We got her on some basic antitussive medications, and she did really, really well. So it is an option. You just want to use both of those with caution. You'll probably find patients that come in and say, I was told I can't take cough medicine, and that's probably a blanket statement that is being given to a lot of pregnant patients, but with caution in really severe cases, probably still fine to use. Congestion. So Flonase is your first line topical stuff. So you're talking Flonase, you're talking nasal rinses. Humidifiers are helpful for this too. Antihistamines, if patients have really runny noses or even in congestion, older antihistamines can be helpful. So first generation. They tend to be more drying, and so they also tend to come with a lot of the other side effects we don't like with antihistamines, like significant fatigue, drowsiness, dizziness. So patients may not be able to tolerate them or may not be able to tolerate them during the day, in which case you can switch them during the day to a second generation. Just know that it's also going to come with less of that drying effect, so you're probably going to get less of what you actually want out of it. And then we have specific therapies. So patients with the flu can get offered Tamiflu. Patients with COVID should be offered Paxlovid. I know that we think of Paxlovid as maybe helpful, maybe not. We have these educated conversations with patients about it. For the most part, OBs have really come down on the side of Paxlovid should be offered to pregnant women. So if you have someone who's pregnant who tests positive for COVID, we should be offering those patients Paxlovid. And then antibiotics for suspected pneumonias. These patients are probably not going to get chest x-rays, so it's much more of a clinical diagnosis. But if the picture fits, antibiotics for suspected pneumonia. Homeopathic things that we should be offering to everybody, just the natural remedies. We already talked about a humidifier in the room, elevating the head of the patient's bed, whether that's actually elevating up the bed itself versus propping up patients with additional pillows. You can end up with something called pregnancy-related rhinitis, and so these patients can end up congested anyway. Just making sure you're doing what you can to help clear the airway and manage that by elevating the head of the bed can be really helpful. Those little nasal strips can be helpful too. They make some magnetic ones that are a lot stronger now, and so those can be helpful just to open up airways and help patients breathe easier at night. We want these patients to stay well hydrated, which means drinking enough fluids. It doesn't have to be crazy. We probably tell most patients that they need to drink more water than they actually do, but enough fluids. And these patients are going to be febrile, they're going to be tachypnic, they're going to probably be sleeping with their mouth open. The insensible losses can be much higher in these patients, so you want to make sure that they're drinking enough fluid. Teas can be helpful, ice can be helpful, sucking on ice chips can be helpful. Echinacea, zinc, both safe in pregnancy, those are fine to take. And then just old-fashioned rest. This will be easier on everyone in your household if you get through the cold a little bit faster, and so taking extra good care of yourself while you're in these specific periods can be really helpful in shortening the duration of a cold. And then I said we'd go over the things specifically to avoid. We already talked about NSAIDs. Sudafed has been shown to be related to some birth defects, and so should probably be avoided. Afrin, it has the same rebound congestion that we have in all patients, so probably not the best, and it also has some split literature on whether or not it can also lead to birth defects, so probably safest just to avoid. And then I just tell patients in general, avoid combined meds, because combined meds will sneak things in there that you don't want. A lot of them will have Sudafed, a lot of them will have ibuprofen, and so really just separating out what you're giving and treating specific symptoms is probably the best recommendation.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.